Hello everyone, my name is Nidia Perez. I'm a second year resident, and today we will talk about this project that titles Family Medicine Residents' Perception on Interpretation Services in Medical Care. It is well known that healthcare disparities are significant among the limited English proficiency patients, who often avoid asking questions even with the use of an interpreter. Needless to say, excellent communication is crucial to avoid adverse clinical outcome. However, deficit in such between the LEP patient and their doctors affect medical comprehension, leading to unfortunate results. While many person-to-person interpreter resources are available, the advancement of mobile technology has allowed for alternative methods of interpretation with the potential to improve communication and consequently clinical care. Research shows that a really accessible interpretation service is associated with optimal communication, improved clinical care, fewer medical errors, and fewer repeat emergency room visits. Hence, the aim of this project is to assess whether an individual handheld translation device can improve communication between providers and the LEP patient, and if improved communication would positively influence providers' confidence and self-perceived quality of care. For our project, we want to use the Pocket Talk device that can translate and interpret up to 74 languages in real time and may serve as an alternative to current interpretation services. Briefly about the method. This project will be conducted in an urban, university-based hospital setting among family medicine residents. At baseline, 29 out of 34 family medicine residents at UT Health completed a survey about their experience with current interpretation services. Descriptive analysis was used to quantify survey results. The objectives of these projects are: first, to describe the barriers faced by residents when working with the LEP patient and limited interpretation resources. Second, to report how the Pocket Talk can be used to communicate with the LEP patient during their inpatient service. And third, to determine how the use of the Pocket Talk impacted residents' physicians' confidence and satisfaction in communicating with the LEP patient. The results obtained were extracted from the baseline survey, which revealed that the majority of them, or 21 of the sample, reported having experienced obstacles in obtaining a hospital provider interpretation services. 18 of them considered speed and immediate availability to be the most important factor regarding interpretation services, while 9 of them selected quality of interpretation as the most important factor. If given the choice of multiple methods of interpretation, 24 of them, or 86% of the sample, chose the Pocket Talk, while the rest chose standard in-person or phone interpretation. Over 60% of them, or 18, believed they would feel comfortable using the Pocket Talk with their LEP patient, and 24 of them agreed that they would like to try the Pocket Talk rather than wait for an in-person, telephone, or video interpretation. Outcomes from the survey show a negative impact in patient care and quality of care when interpretation services are not really available. Timely access was perceived as the most important aspect of interpretation services. Therefore, we hypothesize that residents will feel comfortable and satisfied with using the Pocket Talk device to communicate with the LEP patient. The use of the device will improve communication between the LEP patient and physicians, and residents will find using the Pocket Talk during their inpatient service both efficient and acceptable. Our next step is to compare the quality of communication using the two interpretation methods. We would like to do this during their inpatient rotation, when residents will be given a Pocket Talk device to use in combination with standard interpretation services. Following the use of the device, There will be survey on the effect the pocket talk had on their experience treating the LEP patient in the hospital setting. Lastly, I would like to thank my partner, Dr. Mayan Dam, and our advisors, Dr. Rhiannon, Dr. Fu Wen, Michelle Clowens, and Dr. Desbordes. Thank you for your time.